So this is actually somewhat of perfect leeway. So we're going to go from a content problem, trying to solve content, to trying to solve engagement with one of my favorite companies, Accolade. So Jeff is going to go ahead and present on that. And you got the mic.
I got the mic. And a challenge to go that fast. Thank you, James. My name is Jeff Rubin. I'm going to talk. Thank you all for staying till the end, and I hope it's worthwhile for you all. Today I'm going to talk about real people, real problems, and what I hope you find will be an innovative approach to slowing down the healthcare cost curve by creating genuine, trusting relationships that are empowered through technology. I'm going to spend just a minute, on myself, real short. I'm a psychologist by training and practice. I'm a recovering managed care executive. I worked for Cigna for many years, and I owned the behavioral bottom line. I heard, yeah. And then I found Accolade. I felt like I died and went to heaven. And it's the Accolade model I'm going to talk to you a little bit about today. And the way I'm going to do it is to introduce you to George. Of course, that's not his picture, and his name is not George. I have no idea who this person is. But George is a high-powered executive. It's a very, very stressful job, makes a lot of money, beautiful house in Connecticut. All the facts are true. Beautiful house in Connecticut, lives right on the water, married, 3 kids, loves his house. His favorite things to do is fix up his garden and fix things around the house. He's one of these folks that never been sick a day in his life, right? And then at age 38, he's taking a shower and he drops his mic and he's washing himself and he finds a lump in his chest. And coming from a family of cancer, both deaths and, there we go, deaths and survivors, he's suspicious and he's not unaware of what this may mean. Calls his family physician, sends him to the local hospital. They do a mammogram, they do a biopsy, and sure enough, it's malignant. And the doctor talks about treatment options and suggests a radical mastectomy. They're kind and caring. They talk to him like a human being, and he's comfortable, but he's absolutely scared to death. He's presented with options, but he doesn't really know what to do. He isn't even sure he remembers them all, even though he has them written down. He looks at his notes and he goes, "What was that?" And all of the weight of this begins to sink in, and George becomes very depressed. And as he becomes very depressed, he sinks and starts to isolate himself, and things get incredibly strained at home. So George is a smart guy, not dumb, and he says, I know I'm going to take this into my own hands. I feel really powerless. And he heads to the internet to see if he could figure out something to find. A little factoid, but I'm not going to talk much about that in the sake of time. So George does find a lot of applications, but they're confusing. And none of them help him figure out what to do about his cancer diagnosis. They appear mostly to be for healthy people or people who want to lose weight or want to do lifestyle change. He heads to Dr. Google, maybe even Dr. Wikipedia, which can be worse. And he even tries the cancer blogs, but the cancer blogs are mostly oriented toward women with breast cancer. He finds 1 or 2 things, but he just can't relate. And because of that, he gets even more isolated, shuts down even more, and pulls back from his family, spends all his time at work. As a result, his wife really says, I've had enough. I'll be for you here I can, but I can't live with you anymore. Moves out and sues for divorce. As a result, they have to sell his house, his garden, his boat on the water, everything he loves in the world. And he begins to feel more and more like a cancer victim rather than a cancer survivor. And the moral of the story here is tech can be great, but tech by itself can also backfire. So George reluctantly decides to go to his doctor's office and do what he says. He likes her. He trusts her. Says, okay, I'm going for it. And he calls up his health plan. And what do you think happens? Was it a good experience? Well, you'd think it wasn't, but it actually turned out to be okay because George called Accolade, and we'll get to that in a second. So what if somebody like George calls up and there's a caring, productive, truly engaging experience that can help him clarify all of his options and even support him through those myriad of feelings, right? What if it wasn't smokestacked? And what if his mental health was connected with his physical health, was connected with his chemo, was connected with his follow-up and his medicine? I'll tell you how to get there, but first I'm going to put you through 1 minute. 1 minute of detox. Healthcare detox 101. Okay, let's question your assumptions. What do you think you know about healthcare? You think it's about data? Your data? Big data sets? Yes? Yes? No. Population health? Doesn't help George much, does it? Right? Okay. How about it's about the disease and choosing evidence-based treatment connected with the disease? Yes? Maybe. Would that help George? George tried, can't find it. Right? So what do? It's not all about that. How about the 80-20 rule? Right? 20% drive 80% of the cost. Think George is going to move into the 20%? Absolutely, right? Think that's going to help George personally? No, not at all. So how about the final one, the managed care arrogance, which I'm detoxing from. How about that we'll get George to the right doctor, as if there is one, and only one, right? We'll get him to the right doctor. We'll just manage the hell out of that doctor, tell him exactly what to do, and if he does it, then George will be fine. That right? Stats are great, but as we learned this weekend, they're all about probability. It's about what's likely to happen. It cannot tell you what's going to happen to one individual. That's the nature of probability theory. That's what we all live with, right? They're great, but not on their own. This is George we're talking about, not a segment of a population. It's a segment of one. It's George, and we have to understand George. We have to help him avoid the pitfalls. We have to help him do what's right for him and help him avoid the errors that are inherent in a complex system, right? And there may be some errors here, and we'll talk about those in a second. I think the moral of the story I want to make here on assumption is people are people before their patients, and guess what? People are people after their patients, right? We've heard that again and again, this theme. They think, they feel, they behave, and once they get a disease, that doesn't change. But it's often how others see them, right? You ever go to work and say, oh, gee, that guy's so stressed, or that guy's depressed, and all they become is stress and depression. Who they are goes away. This is no different in healthcare, right? So every person brings to healthcare their past, not just their past and the present moment, but a past which is unique to them. And when it's unique to them, you can't get it from a data set. You have to ask. You got to talk to them. And the one we really care about is George. We want to understand what motivates him. How can we give him the information he needs to get the right care that's right for him? And so I'm going to show you Accolade. And this is what George called, and it's a new kind of company and was built for the sole purpose of helping large companies or health plans retain employees, basically, by just knocking their socks off and delighting them and bending the cost curve, not by doing things traditional ways, but by looking at it as process improvement and reducing errors each and every time. How can I reduce the errors? And think about the errors that could be there for George. Wrong diagnosis, wrong doctor, wrong location, wrong treatment. Do I need chemo? Do I not need chemo? Should I take the genome test? All those things can possibly go wrong. And how we do this is by helping people navigate the system in order to avoid these errors. Accolade's grounded in behavioral economics. How many know about behavioral economics? Great. So this will be, so I can go real fast. All right? Behavioral economics would tell us that all purchasing decisions are driven by emotions. And we all can relate to this if you think about it. I see a watch, man, I'm gone, right? Jewelry, shoes, fancy cars, and everybody here pretty much tech, right? Cool tech we all love. That's pretty obvious. But everybody's a sucker for something and driven by emotions, and behavioral health is no different, but the emotions are different and the stakes are different, right? So what you get is natural, normal fear, sadness, all those natural things that you would expect under this loss, and difference of self-concept, right? Am I a cancer survivor? Am I a cancer victim? Am I George? Or who is this person is what you usually get for a while, which is very confusing. So with all this stuff going on, how are they going to absorb the information? Well, we do that in a couple ways. Number one is that we become the number on the back of the insurance card, right? We replace it. So and what we do is we solve their I don't want to say technical problems, but the concrete problems of healthcare. How much benefit do I have for this? My claim doesn't work. I've lost my ID card. All those kinds of things. We completely give them high touch, high class, world-class service, and we knock their socks off. And by doing that, we earn the right to make simple human questions and say, oh, you lost your ID card? Are you going to the doctor soon? What's up? We speak in normal, natural voices. And if you would call the health plan, how long do you think you'd be on the phone? 2 minutes? Would you get the same person? Our average transactional call is about 18 minutes. Our average clinical call is 28 minutes, right? And some of them are hours. But what we do with that is we're able to help people make decisions that are right for them. We don't tell them what to do. We give them options and show them the consequences of their options. Think about it this way. How many have kids? Men, right? Remember the minute you got pregnant. Everybody got it in their mind? All right. So when you got pregnant, if I said to you, hey, let me tell you what the next 9 months are going to be about, and started talking about when you have to go, what signs to look for, what labor is going to be like, what perinatal thing you need to go through, what to watch out for, you think you're going to absorb any of it? If anybody says yes, I think you're lying. So what we try and do is unlock those emotional traps so that we can close the knowledge gaps that people need. So if I say, hey, let's talk next Wednesday when you've celebrated and calmed down, and we'll talk about just what happens when, and then I'll send you a schedule and all that, they're likely to take this information in a lot better. And we do this through these three things. Our people have to be special. We've heard a lot. One of the things that struck me listening to these things is that people have to be empathetic. And I don't know if you guys have looked at the literature on empathy, but you can't teach empathy. You can teach people to look empathetic act empathetic, and you can take somebody who's empathetic and shine them up like a diamond so that they're really great, but you can't teach it. Our folks go through 5 screens, including role plays for empathy, true cases, to see how they react, okay? They're also wired for service, completely wired for service. They're great critical thinkers. They're great problem solvers. If they can't get what you need through your insurance, they'll find another way. We do a lot of traditional social work as well. They speak in plain language. I mean, plain language. So, you know, all these tests would be saying a biopsy. There's a lot, if I ask James what a biopsy, he's going to give me the technical term. George couldn't understand. Well, George is a smart guy. But there are people that couldn't understand it, right? So we work on, how do I say this in English that you'll know? The cool thing is, you get the same one every time for you and your family. In fact, if you call from the same phone, you'll automatically get them. And something's going to pop up, which I'll show you in a second. If anybody's seen Grey's Anatomy, it's the equivalent of your person. I'm the guy you go to when you need anything healthcare related. And what that does is build trust. And as that trust comes over time, these folks can then say, hey, I know this is tough for you. Let's talk about your diabetes. Let's talk about your healthcare, right? And they go through 6 to 8 weeks of training. Our processes, I'm going to do very short to leave time for questions. Oh, God, thanks. And I haven't even gotten to the technology yet. So the Learn to model used to be Learn Squared, but I didn't know how to do the superscript, so it became Learn to. Stands for listen, engage, assess, resolve, enhance, influence, and enhance. And it's our model. And what we do with this model is we actually listen in an empathetic way. We engage with folks where they're at. We become their person. We assess them not through traditional assessments, which makes measurement really hard, but we don't ask them anything we already know, okay? And because we're solving their claims problems and their disability problems and their pharmacy problems, we have every bit of medical data from all those companies. We get feeds every night, right? So we have big data sets to work with and big data sets to offer to them. Here, let me tell you what your stuff looks like. And we can do it in plain English. Must be a lot of people coming in. Health assistants are coached to find their voice, blah, blah. I'm going to skip. This is the first public display of our technology. In case anybody knows, it's built off a Microsoft CRM system right now. We've just actually purchased an electronic medical record company to kind of put it all together. But this is what pops up. As you can see, this also fake. This is all also fake. All right? But what this tells you at a glance is a lot of things about George that you can talk to him. And a lot of what we do. And it's all family oriented. This is George's whole family, and if I click on it, I'll get information about George's family. It includes motivators. It includes every condition George has. It includes every medication. It includes all George's goals. George-generated goals we may work on that are similar to disease management. Anything happening. Every contact we've had with George. This is the results of our analytics. These are like gaps in care, right? So all the big data set gets fed right in. But we don't, anybody ever take an HRA? What was your answers? Scary to death. You're going to die in 3 days, right? And then the strategy. Behind all this is a medical learning tool, a lexicon pharmacy tool, we keep adding tools. This drives our engagement. Also, see that little black thing up there, segmentation needed? We actually ask them, Do you feel sick? You know that's the biggest predictor of healthcare use. It's how you feel. Am I sick or not? We don't know why, but it is. And how skilled are you at navigating the system and how motivated? Oh, I'm going to run over. Sorry. Two things I want to tell you. All right? This is what this does when you engage in this level. Number one, we get better engagement. Because we do all the legwork, because we do all the administrative stuff, we have a huge funnel. So if you're a disease management company calling out, you're going to call out maybe the 10%. If we're generous, we'll give you 50% engagement that says yes, or we'll answer the phone. So you'll only get 5 to 8% of the sickest patients. We speak to 60% of all employees. So our engagement rates are way up. Okay? We get 8% savings. We deal with large employers. I'll tell you, our largest employer spends well over $1.2 billion on healthcare every month, year, sorry. 8% is a tremendous amount of money. Okay? And we do that again and again and again. And Dr. Schechter, who's a great guy, validated all our findings. Number two, we get better outcomes. Our readmission rate is 23% lower than the health plans. And we do this with control groups. So these are actual figures, right? Our outpatient is 8% less. But we believe you got to offset that in some way, right? Our mental health is 75% higher on the outpatient side. We think that's part of our success rate. And prescription drug is up about 10%. And we think that's about compliance. So everything's in the right direction. And finally, the client experience, 98% client satisfaction, and the Net Promoter Score that we've all been talking about all week, ours is approaching Google and JetBlue. I'm wrapping it up.